Compared to white women, black women are nearly 3 times more likely to die from pregnancy-related complications. Many of them develop cardiovascular issues. As Black History Month and Heart Health Month come to a close, health professionals are continuing to shine a spotlight on health disparities on minority communities, especially the risk for heart issues in black women. WRAL health reporter Grace Haba spoke with one Wake Forest mother who hopes her story can encourage other patients to speak up when something doesn't feel right, and shares the importance for cardiologists to listen.
Cheryl Stokes starts most days just like this, making a cup of coffee in her kitchen. The sweetener, sugar-free, one of the many lifestyle changes the mother made after developing heart disease after childbirth.
My son was born in 2005. I remember when he was being born that I couldn't really breathe, and I thought I was panicking.
Cheryl's breathing grew worse over the next few days. She says she didn't think it was a big deal, but her family convinced her to call her doctor.
She immediately sent me to the emergency room.
That decision saved her life.
By the time I got there, they told me I was having congestive heart failure.
Cheryl had postpartum cardiomyopathy, one of the leading causes of maternal death for black women.
My child is at this point 4 days old, and I'm in the ER, and actually I'm fighting for my life now.
19 years later, Cheryl credits her survival due to the fact that unlike most minority women in her situation, she had good insurance, a hospital nearby, and a black physician who recognized the warning signs.
I say all the time to our residents and fellows, your body doesn't read the textbook. And so a lot of people have different symptoms. And so
Dr. Manesh Patel is a cardiologist with Duke Health and is on the National Board of Directors for the American Heart Association. He says Cheryl's story is a prime example of the importance of not only increasing diversity in medicine, but also broadening access to care to make it easier for women to keep up with regular doctor's visits.
I think it's both the clinical team and the physician groups and the medical teams learning to listen and hear things differently and being thoughtful, but I also think it's raising awareness.
And that's why Cheryl says she will continue to share her story with anyone who will listen.
I feel very fortunate because I know not everybody has access to good prenatal care. It could have gone another way had I not been in the situation that I'm in.
Helping ensure conversations like these continue well beyond the month of February. Grace Haba, WRAL News.
Along with race, doctors say your age, lifestyle habits, and family history can also be factors in your risk of developing heart disease. WRAL dives further into stories like Cheryl's in Critical Term: Why Are Black Mothers and Babies Dying? You can watch the full documentary right now on our website, WRAL.com.